did scalp and skull. Um, we didn't like we touched on meninges, but not anything like super in depth. It was kind of just like a broad overview of everything.
Okay, well, good. What we were thinking is for today, what we can do is if you guys have any like questions about the test as far as like things that you guys want to go over, anything that you can remember that you're like, hey, I want some clarification on this, or even like study tips or whatever, we can talk about the test for a little bit here, and then if you guys want to jump into your new material, we can go into that. But we'll start with if there's anything from the test you guys want to talk about.
I guess one question was if he does decide to do remediation, would one of or all of you guys be up to like a review session again for the old material if we have it? We don't know if we're gonna have it or not. He was like, I'm deciding in 48 hours if you're gonna have it. So we don't know.
Interesting. Yeah, I'm down.
Yeah.
Yeah, it
I'm,
just
I'm up for it.
depends.
Yeah,
Do they
well,
have a
I'll let you
secret?
guys know as soon as we know. I've
Yeah.
already emailed him. If it's on Thursday, I need you to tell me if it's Thursday so I study. Um,
Oh
but
wow, that's soon.
yeah,
That's great.
it's on our syllabus for Thursday, but dang, it's not because we have a neuro test on Friday.
Yeah, no, that's rough. Okay, but yeah,
Hey, can you hear me?
I'm cool too.
Yeah.
Yes.
Yeah.
Okay, awesome. I have a quick question.
Yeah.
So you guys took anatomy last year, correct?
Yes. Mm-hmm.
Did your professor allow you to go back and check your answers while you were taking the exam, or was it you were only did you take it on paper or online, your exams?
We took it through ExamSoft.
Okay. Were you able to go back and like review your answers, or once you submitted your answer, that was it?
What do you mean? You mean like
We
in
we
the
could
test, like if you selected an answer, you can't go back to that answer and change it? Is that what you're talking about?
Was it like that?
No, like you could go back and change your answer.
So that was one of the things that he's not allowing us to do. We can't go back and change our answers, or if we think about it later on in the test, we can't go back, and that's something I struggled with a lot. Um,
What did
I
he
talked to
tell
him
you?
today. I talked to him today about it, and he talked about talking to the administration and seeing if that was something that would be allowed. Um, I don't know if you guys can possibly, email Dr. Lippart and, express my concern about being able to go back and check our answers before we submit the exam.
Right. Yeah, you definitely should be able to. That hasn't ever been something that we've had. Like we've never had a test where that was the case that I can think of.
I mean, I
Unless
even
you,
Yeah,
told him I did some research, and for the NPTE, you're allowed to go back and, adjust your answer choices.
right.
yeah, so
yeah. He said that it was a security issue and that like he doesn't trust us that we wouldn't find a way to like cheat essentially, but we're being recorded. So
Yeah.
Yeah.
I didn't understand that argument of that
And I
that
also, that's
allows
my
a security
strategy.
breach.
I skip questions and go back to them, but we're not allowed, and so that's
Right.
something I struggled with a lot.
Right.
I
Yeah,
mean,
no, even me,
I would understand the practical questions because, if you're realistically, if you're in a lab, you're not able to go back to a structure, but on
right.
lecture material,
Yeah,
uh,
that for sure was for lab, we weren't able to come back. Like you had the allotted time and that was it. You weren't able
mhm,
to come back to a structure afterwards.
yeah.
But as far as my suggestion to you would be is wait to see what he says. Like be respectful of him in the
Oh,
sense that like you've
absolutely.
already brought it up to him and said like, hey, this is an issue. Um, I would talk to him again next time you have a meeting of before an exam and say, hey, like, is that something you've looked into? If he still like ignores you, then I would bring it to, like, I would suggest that you guys bring it up to Dr. Lippard. Like, Dr. Lippard is a very like easy person to talk to. Like, I would just shoot her an email, be like, hey, look, that way it doesn't look like you're trying to go behind his back, or like, hey, I said something to him, like give him a chance to do it. If he doesn't do it, then say like, hey, Dr. Lippart, like trust me, I'm class president for our class, and there have been plenty of things that it's like, okay, well, this teacher isn't doing this, and the suggestion has always been like, talk to the teacher first, wait it out. If they say like, wait to hear what they say, and then go to doctor. Like, don't be afraid to talk to Dr. Lippart, but go through the channels first. But that definitely shouldn't like he should allow you to go back and look at your
And
answers.
and that's one thing Dr. Lippart's like huge on is making sure you talk to the teacher first before you go to her. Um,
Yeah.
and she's super understanding, so like I would rather than us talking to her, I would just shoot her an email unless you already
Okay.
have or whatever, and she hasn't responded because that's kind of
Yeah.
like we're in a doctorate, like not trying to give you the speech, but we're in a doctorate program, and they kind of expect us to be able to try to handle these situations, and that's something that they'll tell you as well if we were to email them.
Yeah.
Okay. Yeah, I addressed it to him, super, respectful.
Yeah,
It's just, I think we should be allowed to, go back to our,
yeah,
our
Yeah.
questions and
yeah, for
get
sure. I mean, you should.
answers. But other than that, like I want to share that what you guys been sharing with the class with the PowerPoints, that's been really helpful.
Good.
Just with the PowerPoint slides. So if you guys wouldn't mind sharing those again,
Yeah.
for me it's just a very condensed way of learning the material with it just being outlined on the slides and stuff like that.
Okay,
Yeah,
cool.
I already put up the ones for the cranium and meninges. They're in there. I created folders too, so they're easier to get to.
Okay,
And there's also a checklist for cranium and meninges, as far as like the lab checklist. That's there too.
awesome. So one way I'm adjusting from this last exam is the Prep U. It seems like he picked a lot of questions from there. So I think, did you guys do Prep U?
No,
So,
we did not.
No, okay. It's just like a database with a bunch of questions. So basically, you're supposed to read the material and then answer the questions on that database. So I think if we do like mastery, at least, and maybe Berkeley you can confirm, like if we do mastery, it's going to help us a lot on that lecture material. So I don't know if that's something we can start doing in the tutoring sessions, is if you guys have access to the Prep U, kind of go through some of those tougher questions. And I think while I'm studying, I'm going to be just doing the Prep U and then just pausing, doing 5 questions, pausing, make sure I can answer those questions and have those memorized, because it seemed like the lecture exam was mainly those questions.
Yeah, I would suggest like we don't have, as far as I know, we don't have
is that
access
is that
to
You
through
have to
the
buy
point or
it, so I
whatever?
don't think you guys would have it. Yeah,
yeah.
it's through the point. But
But
we could like a potential plan that we could do is come to tutoring sessions with ones of like, I keep getting this one wrong and I don't understand why, and like asking you guys to explain that.
yeah, that would be my
That might
suggestion.
work.
Yeah, that would be my suggestion. I know with like I had a private tutoring session with Janelle last week, and that's what we did. She had a couple of prep U questions she brought to tutoring session for us to talk about. One thing I would encourage you with too is like it may seem that he is giving you prep U questions, and
Yeah.
that yes, a majority of it might be like, okay, this question is used from prep U, and you're like memorizing it. That's not like
The
anatomy is
best.
a cornerstone. Yeah, anatomy is a cornerstone of all of the other classes that you're taking. So I would encourage you, yes, like know the questions for the test, sure, but at the same time, don't neglect in knowing the material, if that makes sense, just
Yeah.
because it will come back to bite you in the butt later if you don't know the material.
Especially with anatomy.
Yeah,
Because I
for
really thought I had a good grasp of everything, and then I did Prep U, but only to mastery level 6, which was required, and then you can continue answering questions, different questions. But I thought I had a pretty good level of understanding of the material. Um, but some of the questions, it's like yeah, I know a lot about the material, but I still wasn't able to apply that information that I knew to get the correct answer.
Yeah, I think like having questions to apply, and I think even if we're able to talk them out, like if you guys bring your questions to us, I think it helps to kind of just think through it. And it's one thing to like have the information, then another to be able to say like, okay, here's how I apply that information. So if you guys want to bring those to us in the future, I'm definitely down for that.
Okay.
Is there anything else as far as the test goes that you guys want to talk about, whether it be questions or anything? I know it's kind of probably hard to think of off the top of your head, but if not, we can go into if you guys have any questions over the new material. And if you don't have any questions, then we do have some stuff we can tell you about the new material.
Yeah, honestly, I haven't really looked much at the new material, and I decided today that I wasn't gonna watch his conference call live. So I'm gonna, after this, go back and just watch the conference call, but speed it up because I can't watch it while he's doing it live. It's too unorganized. So, whatever you guys have planned, help.
Good. Anyone else have any questions? If not, we can go into what we have.
No, I'd say we're all pretty brainwashed after the test, so we're just ready for you to just spit out what you have.
No worries. I totally 100% understand that, dude. After tests, I'm over it. Okay. Let's see. Aaron or Matthew, do you guys want to start us off, or do you want me to? I don't mind either way.
I can just read off the list and then see if they have any questions from what we're saying. But once we get to, I would say the whole contents, we should probably stop there and go over that.
Okay.
So if you guys have any questions on anything I say, just stop me at any point, okay? So I have neurocranium versus viscerocranium. The cranial sutures, know where they are and what borders they're a part of. The terion, which is the meeting of some of those sutures, I would know what that is and what happens when that is damaged.
Can you go through that really fast?
So the terion, Pterion, do you guys know what that is? Probably not, because it might just be fresh to you guys, but we can pull up a picture, but it's basically a meeting point for a lot of the sutures on right next to where your temple is. It holds the medial meningeal artery, and this point right here, where the sutures meet, is the weakest point in your cranium. So it's easily damaged, and when that's damaged, it can lead to an epidural hematoma.
Okay, can you guys see my screen?
Yes.
Okay, so this is where the terion is. So it's going to be the meeting of the frontal, parietal, and sphenoid bones right here. And like Matthew said, it has the medial meningeal artery that runs underneath it. So if you get hit there, if you have a fracture at that point, what can happen is that medial meningeal artery can be lacerated, it can be cut, and then you're going to get, like you said, a hematoma in the epidural space. So that's really important. In fact, I think we had a test question on
Okay.
that.
What was that artery again?
Medial meningeal artery.
Okay.
So yeah, it's where all of these bones come together. Know the bones that make it up, so the frontal, parietal, and sphenoid. And know that the medial meningeal artery runs underneath, and you would get an epidural hematoma if it gets lacerated. Okay, you can continue with the list, Matthew. I'll keep the PowerPoint up here if there's anything we need to go over.
Well, next is the. Go ahead.
I know there's a lot of like fossas and tubercles and stuff in the skull. Should we be pretty familiar with all that?
Yeah, I'm just about to go over that right now, or Tanya or Aaron, we can all go over it. But there's I don't know if you guys have a picture, but we'll pull up a picture of basically the contents of each hole and where they are.
Okay.
Yeah. So.
I don't think he sent us anything yet. right, Berkeley?
Yeah, we don't have anything for what we
Okay.
covered today.
This PowerPoint is up. Again, I can share the link again with you guys after I'm done sharing my screen.
Perfect.
But it's under that tutoring Dropbox. It's under
Yeah.
PowerPoints, so that should be helpful. This is what you want, yeah, Matthew?
Yeah.
You want me to try to zoom in more?
Yeah, you can go over it. But this picture right here, on my slides, I have a big like highlight over it, and it's a lot of just memorizing, and it's gonna be kind of sucky to have to go over it, but it's just something you're gonna have to do. Um, yeah.
I'm trying to.
Make this bigger so you can actually see what it says.
But for sure, I would know like cranial nerves
Yeah.
and this one, like where they exit pretty much.
Yeah.
Like
And
veins and vessels and like arteries and veins are important, but from what I remember is like cranial nerves, he asked the majority of questions on the cranial nerves.
and you guys haven't gone over cranial nerves and anatomy yet, have you?
No, not yet.
Have you
Have
gone
you gone
over
over
them?
them? Yeah, neuro.
Yeah.
No.
No.
Okay. This will be a
Um,
double duty. It will help you in neuro too because
okay.
Dr. Lippert loves those cranial nerves. Okay, so you guys have not gone over this in anatomy yet.
Correct. But
Today he
maybe we
quickly
did.
was like, this one comes out right here, this one comes right here, but
Okay.
like that was it.
I mean, we can go over them right now if you guys want to. I feel like it's mostly memorization, but we can go through each of them if that you feel like that would be helpful for you guys. Yeah,
Yeah, that'd
no.
be helpful.
Okay.
What's the best way of tackling all of these? Just
Um,
looking at them constantly?
yeah,
Okay.
pretty much just like looking at them. Um, and let's see here. Okay, so there's two different views that are on this picture. Obviously, this is coming from a inferior view. So if you have the skull tipped upside down, so that's this view, and this is looking from a superior view with the cranium cut. So we can start on the bottom. It's a little bit hard to see, but if you go back to this picture here, this right here is
Hmm.
the incisive fossa. So it's right, if you think about your incisors are some of your teeth, right? So the incisive fossa is going to be right there on the palate. And the incisive fossa will have the nasopalatine nerve and the nasopalatine artery. So that one's kind of easy because it's coming from your nose to your palate and it has both the artery and the nerve. And then next is your greater palatine foramen. I think you can see it that well here. I don't think he really emphasized this one as much, but we can still go over it. So greater palatine foramen is going to be right here. And again, it's in your palate, so it makes sense, and it's going to be kind of closer to your molars. So your greater palatine foramen is going to, again, this one's pretty easy. It's going to have your greater palatine nerve and artery. So the artery and nerve run together just like the incisive canal. And then here, right underneath it, so the greater one is more, I guess you can say, is more distal, and then the lesser is more proximal. So the lesser palatine foramen, again, pretty easy, has the lesser palatine nerve and artery. Again, these two aren't super duper important. Let's see. These, however, are very important. So the foramen lucerum, I'm going to go back to this picture because I feel like you're going to be able to see it a little bit better. They have a really good picture of it here. Do they? Yeah, they do. Okay. So this right here, where my little cursor is the foramen lucerum. And then you're gonna have, after the foramen lucerum, then you have the foramen ovale is going to be the next one over. And then the one over from that, they don't have it labeled here, but it should be the foramen spinosum, which is right here. So if you're going from like medial to lateral, it's going to be I guess the way I learned it is medial to lateral is los. So lacerum, and then ovale, and then spinosum. So again, here's another view of it: lacerum, ovale, and then that little guy right there, again on this side here too, is spinosum. So let's talk about what are in the three of those. So the foramen lucerum, again, these are really important. Foramen lucerum has the deep petrosal nerve and the greater trossal nerve.
And what exactly do these nerves do?
Right now, don't worry about that too much.
Okay.
He'll
Okay.
get into that a little bit more later, but right now, just know where they come out of.
Okay.
Let's see. Then when we talk about the foramen, where's ovale here? It's right there, but they don't have. Here we go. On this side, foramen ovale. So from the foramen ovale, again, this is important. So cranial nerve 5 has 3 different portions that come out of it. Like it has 3 different subdivisions. So this one, the mandibular nerve, is also known as cranial, excuse me, cranial nerve 5, but it's the first division. So foramen ovale has the mandibular nerve, which comes out of, which is also known as cranial nerve 1. And it also has the lesser petrosal nerve that comes out of it. Let's see, and then foramen spinosum, over here, this guy. This one has the medial meningeal artery. Where have we heard of the medial meningeal artery before? We just talked about it. What is that area called? We just talked about. The weakest part of the cranium, where all of those things come together.
Sternum.
Huh?
It start with a P.
Uh-huh.
It's where your frontal and your frontal and your parietal and your sphenoid come together. What is the name? I can't
You're
remember
right.
the name.
It does start with a P, but it sounds like a T. It's the pterion. So it makes sense that the medial meningeal artery is coming here, because if we were looking at this from a side view, the pterion is going to be right here. So if the medial meningeal artery comes out here in the foramen spinosum. And then you also have the mandibular nerve V3. So again, the cranial nerve 5 is coming out of here, but this time it's going to be the 3rd division. Do you guys remember Matthew and Aaron? Do you guys remember the mnemonic that he gave us for these?
For the cranial nerves, or
No, remember there's here we go. This is the one I'm thinking of. So we're going to jump for a second. I know this might seem a little bit sporadic, but we're also going to jump over here to this round on the inside. There's the foramen rotundum, just because we were already talking about the different nerves the different, what am I trying to say? The different divisions that come off of cranial nerve 5. So the maxillary artery, which is cranial nerve 5, the maxillary nerve, which comes from cranial nerve 5, but it's the 2nd division, comes out of the foramen rotundum. So in order to remember what comes out of this one, the foramen rotundum, remember that max runs around in a rotundum. We were still on this side. Okay. So the next one we're going to look at, again, we're going to go back to the inferior view, the carotid canal. There's a better version here without everything in it. At least there should be. You guys see it on here?
I don't.
Oh, here we go. Carotid canal. It's right here. So this is the carotid canal. And if you look at this little guy here is called the styloid process. It kind of looks like a stylus. So the styloid process comes off. And then if you go just a little bit medial to the styloid process is where you will see that carotid canal. And what do you think comes out of the carotid canal? Just a guess. Huh?
The internal carotid.
Yes. So the internal carotid will come out of the carotid canal. And this would be the external carotid canal because obviously it's external, not in the inside. If we flip the view and we look inside, here's a view of the carotid canal, but internally. Okay, next thing we will look at. Is this helpful at all for you guys?
Yes.
Okay.
Yeah, the more we go over it, I think the quicker we'll get an understanding of it all.
This I wouldn't worry too much about, the petrotympanic fissure. Okay, we already went over this, the styloid process. So just below the styloid process, there's a stylomastoid foramen. So that's just a hole so it's called the stylomastoid foramen because it's close to the styloid process and it's also close to the mastoid. The mastoid is this little bump right here, and I'll give you this view here as well. So here's that styloid process, here is the mastoid process, and that's where the stylomastoid foramen is. It's sometimes also just called, the stylomastoid foramen.
And the mastoid process is you can feel that bump right behind your ear.
Yeah, if you go from your ear and slide just back a little posteriorly, you should be able to feel that bump. On me, it's actually a little bit tender, but I get headaches all the time, so it might not be as tender for normal people. But okay, so right here, stylomastoid foramen. This is very important. This has your facial nerve that comes out of it, and it also has your stylomastoid artery. So important. The most important thing to know about this one is that the facial nerve comes out of here. And again, we'll talk about like what these things do later on, but for right now, just know the anatomy. We'll talk about the physiology, so to speak, of it later. Let's see.
So I don't want to jump ahead, but like in regards to questions asked about these, fossas and all this stuff, it would be relevant to the nerve. So we'll learn more about that later.
Yes. Yeah,
Okay.
and we can go over some of that like if we have time today even. But for right now, I just want you guys to be familiar where they are, and then we can talk about what they do, because I feel like if we stopped for each one of them, it might get a little messy. And then it's also a good review when we're talking about what they do to go back and look at where they come from. But as far as the questions that you might get for them, let's say you get a question about there is I don't know, someone gets a crush wound of their skull, right? So that it's near the styloid and near he probably wouldn't be that helpful even. Like let's just say it obstructs the contents of the stylomastoid foramen. How would the patient, they might ask how would the patient present, like what would be wrong with the patient?
Yeah.
So here we have the facial nerve. The facial nerve innervates your face. But so they might have like loss of sensation in their face, for example. So that might be one of the questions. Like, okay, if there was a crush injury and the stylomastoid foramen was compromised, what are the contents or what are the effects of,
Gotcha.
from the contents, if that makes sense. So you would need to for sure know what the contents are. and then you would need to know the effects of what happens in them. But like I said, I don't want to bombard you with the information of everything of where they come from, so or what they do. We'll just look at where they come from for right now, if that's cool with you guys. Okay. Aaron or Matthew, if you guys want to take over, you're more than welcome to too. I don't mind doing it, but if you guys want to take over at any time, let me know.
I mean, if you're tired of going over, I can take over if you'd like.
No worries. I don't mind if you guys have anything to add or whatever. I just don't want to be
Uh,
hogging the tutor time.
oh no, you're fine. But additionally, like for the style, let's say they asked a question about the stylomastoid foramen, they could easily ask like the stylomastoid artery is cut near the foramen. What nerve is affected? Some location kind of question like that. So the facial nerve, it runs right next to the stylomastoid artery in that foramen. So if that artery is cut, the facial nerve could very well be injured as well. So that could also be a sort of question they could ask.
To know what runs together too. Like know basically if you know what the contents of each hole is, you'll be okay.
Okay.
Because you'll know what goes together.
What did you say the name of the second division of cranial nerve was? Like the other name? Or does it not have one?
Cranial nerve 5.
Yeah, the second division.
So the
Maxillary.
division 1 is the mandibular, division 2 is maxillary, and division 3 is what is division 3?
I think.
Division 3 is mandibular. No, Division 1 is ophthalmic, I believe.
Yeah.
Thank you. Yes, you were correct in saying that. Thank you. I think I may have misled you. For foramen ovale, it should be cranial nerve 5, division 3. I might have said division 1, but it should have been division 3. Okay. Are you guys cool to move forward? Do you guys have any other questions so far?
I'm good.
Good. Move forward.
Okay, so the next one, again, this one is very important. It's the jugular foramen. So that's going to be this one right here. So in order to find the jugular foramen, these are also like fair game for lab exams. In fact, like they like to ask these. Sometimes, at least for us, what they did for lab exams is they would take the skull and they'd put like a Q-tip or like a stick or something and be like, what comes out of this hole? Or if something happened here, like what would be, or what's the name of this? Or it could be all of the above. They might ask you 3 questions for one thing, like what is the name of this hole? What comes out of it? Like that kind of a thing. So it's good to kind of orient yourself. So let's use this picture here. So we already know that this is the external carotid canal. And then if you come just down, drop off from the external carotid, then you're going to get the jugular foramen. You go just to the side of it. We have the, what is this space called? One right here. This little dot. What's that one?
I can't see where your cursor is.
It's okay. So it's my,
Is that
can you
the
guys not see my cursor?
The stylomastoid foramen?
Yes. Okay. So that's the way that you can kind of figure out where you're at. So carotid canal, styloid mastoid foramen is over here, and then your jugular is right here. So sometimes it might be a little bit hard to remember which one's the jugular and which one's carotid. Just remember carotid is going to be more distal, jugular is going to be more proximal, and it's also a bigger hole because the jugular is going to be much or bigger than the carotid. So obviously the jugular foramen is going to have the internal jugular vein come out of it. Again, this has a lot that comes out of it. I believe there's 6 things in total. Yeah. Okay, so first thing is the internal jugular vein. Second is the glossopharyngeal nerve. That's important. Is the vagus nerve. Again, very important. Fourth is the accessory nerve. Vagus nerve is also known as cranial nerve 10. Then you have accessory nerve. Accessory nerve is cranial nerve 6, yeah?
I think it's 11.
11. Yeah,
No, it is
11.
11. You're right.
Abducens is 6.
You're right, yes.
And then
Wrong age.
glossopharyngeal is 9, I believe.
Yes. So that would be important to know. So
Yeah.
nerves 9, 10, and which makes sense. 9, 10, and 11 come out of the jugular foramen. This is not so important, but the inferior petrosal sinus is also found here, and then your posterior meningeal artery comes from here. Those two I wouldn't worry too much about, but I definitely would know that cranial nerves 9 through 11 come out of there, and the internal jugular vein comes out of
That
the
even
jugular vein.
kind of rhymes if it helps you remember. Kind of like the phrenic nerve and the other one, but like 9, 10, and 11 jugular
9,
foramen.
10,
I mean, if
11
that, yeah,
jugular
if that helps.
foramen. Hey, it works. Whatever works. Okay, let's see. Mastoid foramen, I wouldn't worry too much about. The hypoglossal canal, this one is found right here. Let's look at a better picture of this. You can't really see it too well, but this right here, this little dot, I don't know if you can, that where my cursor is, it's right between the orange and the purple. That is going to be the hypoglossal canal. And the hypoglossal canal will have the hypoglossal nerve, and then it will also have basically the hypoglossal vein. It says the venous plexus of the hypoglossal canal, but you can think of it just as the hypoglossal vein, and that's fine.
And the hypoglossal nerve is cranial nerve 12.
Yes. Thank you.
We'll go.
Okay.
You want to go out over the cranial nerves like the mnemonic after this,
Yeah,
Yeah,
so
we
they
yeah.
kind of have an
That would
idea.
be helpful.
We'll
We'll
go
go over
over that right after.
yeah, we have time to. Let's see. The condylar canal, again, I wouldn't worry about that too much. Okay, so we've gone over everything that you can see basically from an inferior view. Let's go over the foramen magnum. So the foramen magnum is that big old hole that's in the bottom of your skull. And this has a lot of things that come out of it. So it has your spinal vein, it has your anterior spinal artery, which makes sense. It's the artery that runs from the front. In fact, you guys will probably have to learn like the circle of Willis, which I'm a big fan of. I know most people don't really like, but we'll go over that later. Third, you're going to have your posterior spinal artery. So there's an anterior spinal artery, and then there's a posterior spinal arteries that run in the back. Let's see. And then you obviously have your spinal cord that runs through there, and you have your vertebral artery that runs through as well. So spinal vein, your anterior spinal artery, posterior spinal artery, spinal cord, vertebral artery, and then, oh yes, the accessory nerve, which again was cranial nerve 12.
So the medulla connects to the spinal cord, or it's attached. They're both, yeah. Is the medulla superior to that foramen magnum?
Yes, the medulla is going to be still inside the cranium, I believe.
Okay.
Okay. So now that we've done with the inferior look, we're going to now look at the superior look with that top portion removed. So some of these will still be the same hole, you're just looking at it from a different view. So the first thing we're going to look at is the cribriform plate. This you can't really see very well, so I'm going to give you guys a look. On this side, so the cribriform plate is basically those little holes there, and this is part of the ethmoid bone. There might be, no, there's not really a better picture of it. I was looking for one, but that's okay. But yes, the ethmoid bone has a bunch of holes in the top of it, and then it also has this little shark fin guy here that's called the crista galli. I don't have a better picture at the moment, but yes, it looks like a little shark fin. But the ethmoid bone has those little holes, which are called the cribriform plate, and the cribriform plate has nerves. Those little holes have nerves that come up from it, and that's basically when you smell. Those nerves are the smell is the olfactory nerve is the one that kind of hints that you're getting sensory input from there. So olfaction is smelling. So olfactory nerve comes from your cribriform plate, which is right above your nose. So that's a good way to remember that. And then it also has the anterior and posterior ethmoid artery, which again makes sense because this is your ethmoid bone that the cribriform plate is from. The arteries I don't think are as important as just knowing that the olfactory nerves excuse me, come out of the cribriform plate. Again, I'm pretty sure we had a test question on that. Okay, next we have the optic canal, which this portion right here, if you were to be able to see through, that's where your eyeball would be sitting. So it makes sense that your optic nerve is coming right out from there. Let me see if I can get a better picture without anything. And you have it right here, your optic nerve. Again, your eye would be sitting right here, so your optic nerve is coming right out of here. I kind of look at this, trying to show you a better view. Okay, that bone is that it's on is the sphenoid bone. So your optic canals are found in your sphenoid bone. This is another look of the sphenoid bone, and this picture right here, I'm going to try and blow this up a little bit. Okay, so this bone is if you like took it out from the picture on the left where it's highlighted in green and you're looking at it isolated, it kind of looks like a bat, all right? So the bat's eyes right here, which is if you're looking at it there, is where the optic canal is, and that's where your optic nerve comes out of. Everyone still following me?
Yep.
Okay. Next one, let's go down, is the superior orbital fissure. So if you follow this down here, it's kind of the, this is called the, I believe this part is called the inferior wing. Let's go back to our picture. Yes, the lesser wing. So I like to see this as like the bat's little face. Some people see it as it's called the inferior wing though, and this part is called the greater wing. So that lesser wing, that is where the in or the whatchamajigget. Go back to this picture.
Orbital fissure.
Yeah.
Yeah.
Thanks. That's where the superior orbital fissure is coming from. So right off of that lesser wing is a superior orbital fissure. And this has a lot of things that are coming out of it once again. Again, it's going to be related to the eye because think about where our location is. The eye is right here. So you're going to have these are extremely important to know. You're going to have your superior ophthalmic vein come out of it. You're going to have your lacrimal nerve, your frontal nerve, trochlear nerve, abducent nerve, oculomotor nerve, and nasociliary nerve come out of there. And let's see. Abducens is cranial nerve 6. Trochlear is,
Four.
Yeah, trochlear is cranial nerve
And
4. And ocular
not
motor is cranial nerve 3. Yeah.
Yeah, that's right.
So you have 3, 4, and 6 coming out of the superior orbital fissure. Those are definitely ones you want to know.
Can you repeat which cranial nerve there again?
So you're gonna have cranial nerve 3, which is your your ocular motor nerve. Cranial nerve 4, which is your trochlear nerve, and your abducens nerve, which is cranial nerve 6. Again, we'll go over the functions of these in just a little bit. How are we doing on time? Okay. Speed it up. All right. How you guys doing?
Okay.
Okay. All right. We went over the foramen ovale before, but here is it again. It's right there, whereas before it's over here. So you can see it in both views. Again, it has the mandibular nerve, which is cranial nerve 5, division 3, and then you have your lesser petrosal nerve. That again, I wouldn't worry too much about. Okay, your carotid canal, again, we went over what comes out of that. Can anybody tell me what comes out of that?
The internal carotid.
And what else?
The internal carotid sympathetic plexus.
Yes. I would just know for now the carotid artery is fine. Let's see, foramen spinosum. We went over this before. It can be seen over here, this little guy. And what comes out of that? Anyone remember? A very important artery. It's seen here and here.
The
What
medial
artery?
meningeal artery.
Yes, medial meningeal. And also what cranial nerve?
Five?
Yes,
Yeah.
cranial nerve 5. What division?
3.
First.
Yes. The third one. I said first the first time, sorry, but it is the third. So yes, know those for sure. Okay, and then this I wouldn't worry too much about, or that. The inner, okay, so this is the internal acoustic meatus. Let's try to find a better picture of this. Right here. So this, the bone that this comes off of is called the temporal bone, and the temporal bone has a portion, oops, right here that's called the petrous ridge. Petrous means rock, so it looks like the ridge of a rock, right? So if you look right at the petrous ridge, right off the edge of it, you will see the internal acoustic meatus, also known as the internal auditory canal. And you can assume by the name of it that it's going to have something to do with the ear. So this has the labyrinth artery and vein, and then it has the vestibulocochlear nerve and the facial nerve.
And the vestibulocochlear is 8, and facial is 7.
Yeah.
Cranial nerve 7.
Did you hear what Aaron said?
Yes.
Okay, perfect. So you can also see, it's kind of hard, we didn't go over it, it doesn't have it listed, but this right here would be the external auditory meatus. It's just the hole where your ear would be. And it's obviously holding the same contents. Okay, last one is the jugular foramen, which we already went over. It's just looking from it from this view, except for it's really hard to see with all of that labeling. So let's look at it from over here. So again, it's right here. And what is found in the jugular foramen, if you guys remember?
The jugular vein.
Jugular.
Huh?
The internal jugular.
Okay, what else?
Cranial nerve 9, 10, 11.
Yes, good. Okay, and then here again, you can see the hypoglossal canal, which makes sense because if you think about where this is in the skull, this is right where your palate would be right underneath here, right? And then you have your tongue, like the back of your tongue would be sitting right here. So the hypoglossal canal, glossal meaning tongue, hypo meaning technically blood, but this is sitting, or it's a nerve that goes right below your tongue.
Okay.
And we went over what goes through the hypoglossal canal. Can anyone remind me what goes there?
Cranial
Just
nerve
the
12.
Also known as the,
Hypoglossal nerve.
yes, good. All right, and that can be seen here. It's a little hard to see, but hypoglossal canal is right there. Okay, Aaron, do you want to take it away with the cranial nerves? Or Matthew, either one of you?
Um, is Aaron talking? I can't see. Is he muted? He's muted.
Yes, I was muted.
Okay.
Yeah.
Um,
You can do it.
do you have a clean version of it?
Um, I think Tanya does, but so we have a mnemonic. We can't say it here.
I
I
have
can
a good
text you
version of
later
it,
if
yeah.
you want to know our version, but you can follow Tanya's version for now.
It's the ooh 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 to touch and feel very fine velvet.
Okay.
Yeah. Do you have a picture of the? Here, Aaron, I can pull up this picture.
Here, I'll stop sharing my screen. So yeah, that's the mnemonic to remember it.
And that just correlates with the first letter for each cranial nerve. So yeah, so you can see one
so
is
this is
olfactory, which is the first oo. Two is optic, which is the second oo. Three is oculomotor, which is the third. What was it? Two touch, the trochlear trigeminal, and would be the abducens. Feel would be the facial. Feel. What did you use?
Very.
Very would be vestibular. You want to just get these last three? I don't know what the mnemonic.
Oh, what?
What was your mnemonic? Just
Ooh,
say the
ooh,
last
ooh,
like
to
four.
touch and feel very. Oh, sorry. Very good velvet. I can't remember what I had for the A and the H. Heavenly. There we go. So it's ooh, ooh, to touch and feel very good velvet. Heavenly.
Yeah. I mean, you don't have to use that one. That's the clean one we can say right now. You guys can text us for the other one. You can also look up your own. There's a lot on the internet to figure these out as well. But yeah, continue, Aaron.
I mean, that pretty much explains that. Do we want to go into function right now, or will that be too much, y'all think?
I don't want to go into function too much yet because I think they're going over next lesson, and I think it's messy from there. But we can do sensory versus motor or whatever. I think
we
that's
also
something.
have like 2 minutes, so I don't.
Yeah.
Oh, yeah. I'll do this really quick.
All right.
So for each one of these, you can do the mnemonic. Some say money matters, but my brother says big brains matter most. And so if you follow that mnemonic and you match the letters with each number, the S stands for sensory, the M stands for motor, and then the B stands for both sensory and motor.
And that's just the easy way to help you remember kind of their function, like more specifically. At least it was for me.
Mm-hmm. Like whether it has a sensory or a motor function, or if it's both sensory and motor.
Additionally, so we went over that cranial nerve 5, trigeminal, has 3 branches. Again, those 3 branches are ophthalmic, maxillary, and mandibular. Cranial nerve 8 here, vestibulocochlear. It separates into the vestibular and the cochlear nerve separately, where one does hearing and one does balance.
Vestibular does the balance, cochlear does the hearing.
Yeah. Vagus, I would get very familiar with vagus. It does a lot of things. And accessory nerve is going to innervate your, what is this? Your traps and your sternocleidomastoid. So that's the main function for your accessory. That's just a quick rundown of these. It's going to get a lot more complicated.
As he zooms out.
I'm not going to lie to you guys. It's going to get a lot more and you can see like all the notes I wrote on this when we got here. So
Yeah.
it's, I mean, obviously you guys will get into specifics when you get there. And we'll teach you a lot more things, especially there's some stuff with eye movement and whatnot that we'll get into later. But yeah, so that was just a quick rundown for background knowledge for you guys for now.
And for me, memorizing these was just, I wrote it down just over and over again.
Yeah, same.
Can you say the mnemonic for the sensory motor in both again?
Yeah, so some say money matters, but my brother says big brains matter most.
Do you guys know of any good YouTube videos in regards to cranial nerves? And that
Honestly,
you
I've never used YouTube videos for studying, so I'm not the
Really?
person to ask. No, YouTube videos don't help me as
Oh,
far as like learning stuff, but I know a lot of people use them though.
yeah.
I don't know of any right off the top of my head, but I would imagine for the canals, there's probably some pretty good ones that
Okay.
explain it really well.
I actually had to do a presentation on cranial nerves. If I can find it, maybe I'll post it in our resources.
Okay.
I had to do a cranial nerve like for my anatomy. I don't know, you guys will have it, but you had to do like an anatomy like presentation or whatever. So I had cranial nerve. So I might, if I can find it, I'll post it for you guys. But it's pretty much what I already told you guys here. So
Yeah, any resources that you guys have, they're super beneficial. So,
Sounds good. And like I said,
for sure.
the PowerPoint that I started to share with the
yep.
cranial nerves and stuff, that's up already. And so is a list, like a checklist that you'll want to be familiar of stuff to go
Okay.
over to the lab. Hopefully that was helpful, and we can go more into function later on if you guys need it.
Awesome. Well,
Any
thank you.
questions?
No, well, not for me. Berkeley,
No, I'm good. Thanks, guys.
No worries.
thank you. Have a good day.
You too.
Bye.
I'll too.